Thank you very much, guys, and pleasure to meet you all. I'll give a quick kind of overview of who I am and how I got into genetics, and then I'll show you a presentation and talk you through the presentation, explaining who Muhdo are and what they offer. So, as I say, my name is Wez Pooley. I'm a performance director and co-founder of Muhdo Health. I am an ex-international professional rugby player, and then I've been working in the fitness industry and education industry for over 20 years. I was then very fortunate to work as a strength conditioning or a performance specialist with England women's football, Brighton and Hove Albion in the Premiership, Olympic athletes in athletics, tennis, boxing, gymnastics, and then also across different range of sports like rugby as well, obviously my background. And then about 8 years ago, I came across genetics. So the reason this happened for me was with all the stuff I had as an international athlete, I wanted to figure out how I could basically longevity-wise increase the length of my career and understand how I can continue being fit and healthy and looking after myself. So I did a lot of research, found genetic profiling, and from that point onwards, once I got my results, I could actually found out certain things, why I was getting soft tissue injuries, how to lengthen my career, how to improve my training, nutrition, and stuff like that. So kind of the three key takeaways I got from my genetic profile were the vitamin and minerals that I was taking were not kind of prescribed to me. I was taking ones I didn't really need because I was having a healthy diet and I was eating the right sorts of food. And they kind of helped me with focus and cognitive function and energy levels. I also found out that I don't process carbohydrates very well. So I adapted my diet and changed my diet so that I could get the right sort of energy at the right sort of time. And then the other final one from a more of an athletic perspective for me, but it can occur in obviously the general world, is my inflammation level was very, very high, which basically means when you exercise or when you're stressed, your inflammation goes up, which then can cause illness and injury if you don't manage it correctly. And I wasn't managing it correctly. So I now know how to manage that correctly, which has now allowed me to basically continue playing. I actually have a World Cup next year in Argentina. So I'm still playing at a half decent level, which is great. So what I'm going to do now is I'm just going to share my screen just to show you kind of a presentation based off Muhdo Health. And then please feel free at any point to ask any questions, and I'll happily answer them at the end. So basically, Muhdo Health, we're looking at a new well-being approach. So innovation in this area now in like kind of health screening is really important, because we've got kind of health screening that doesn't allow you to actually measure the changes you put in place and doesn't give you those actionable interventions that are really important to help you make those changes. So the idea behind what we do, we're a preventative healthcare partner with lots of different companies and industries. We're a health tech company, so everything we do is through a mobile phone app, so you get to see your results on your mobile phone, which you carry with you all the time. We're all about behavioural change. So the most important thing to understand is can you engage with people, and then can you make them or help them change behaviours? And we do that through a simple process of actionable interventions in the app. So every single outcome in the app, there is science backing it to basically enable an outcome to happen, so you can then make those small, simple changes. And we always say, look at one change a week. So over a 12-week period, you can make 12 changes. It's just the idea of which change makes the biggest one. And we always link back to vitamins and minerals, which I'll explain a little bit further down the presentation. And then the final point to understand, which is really, really helpful, is it's a simple saliva analysis. So it can be done in anywhere in the world, and it's really unintrusive and really simple. And the science that backs it up is very high. So basically, Muhdo Health, we are, as I explained, we're a epigenetics and DNA company. The difference between them are DNA is fixed from the day you're born to the day you die. So that doesn't change. So once you've had your DNA done, you basically have a blueprint to your body to help you understand your body to make simple and basic changes. But at Muhdo, we're all about, if you can't measure it, how can you improve it? So that's what epigenetics is. So epigenetics is looking at how your genes change over time based off your lifestyle and your environment. So we're looking in total at your longevity. How do we reverse and slow down your aging process? And again, obviously, all that's done is on simple saliva analysis at different points in time. We have companies that do it every 3 months, 6 months, 9 months, 12 months. We have some companies that do it every 6 to 12 months, because all you're looking at doing is how do you monitor the change you're putting in place. The key metric we use here is what's called biological age. So if I explain that really quickly, your chronological age, so I'm 35 today, but my biological age is 40, I have then got an age that's 5 years older than I should be. Therefore, I need to understand how I can slow that down or reverse that. And that's what we do. We provide that information that links back to your DNA to say, you need to take X, Y, and Z. And again, I'll come on to that in more detail as we go forward. A couple of things I wanted to explain is the difference between kind of what's internal health and internal age to kind of how we all kind of perceive ourselves externally. So externally, you have kind of like, you might look at ancestry kind of DNA testing. You may look at it kind of as, I have blue eyes, I'm this height, I'm this body shape, etc., etc. We kind of all know that, and we know that everyone's different. It's exactly the same with your internal health as well. We all have stomachs, we all have hearts, lungs, etc., etc. But how our stomachs may and our guts may produce and absorb things is different. How we all move through our lives is different. So your internal affects your external. So if you have, I normally want to use is skin health. So if you have a skin issue, it's normally people kind of tend to take creams and use creams. The problem with that is you're not actually overcoming the actual cause of the issue. You're actually just masking it. So the idea is actually it's normally a vitamin mineral deficiency that you need to know about, that you can then make those changes. And as part of kind of our longevity, our epigenetics, we also look at 3 other metrics that change over time: your hearing, your memory, and your eyesight. Obviously, we all know they deteriorate with age, and we can provide information of how to slow down that area. Also, we look at what's called inflammation score. So your inflammation can be based off stress or exercise, and it's really important to understand that inflammation is very, very good, but it just needs to be managed, and how you manage that is really, really important. So just some key points based off Muhdo Health. So as I explained, we're a new innovative health screening. We use saliva analysis that all link to your mobile phone. So it's really, really simple to do, can be done in your own home, can be done in your office, can be done anywhere in the world. We're all about hyper-personalizing basically health and lifestyle markers to allow you to understand how to make changes in overarching ideas is how do we slow down and reduce the aging process. The key is obviously, as I said earlier, it's all about behavioural change. How do we get you to make those changes? And normally biological age is a really good one that allows you to see, I'm a little bit older than I should be, I need to make some changes. But also off the back of your DNA, you'll see there's certain things in there that you'll be kind of going, okay, I need to make those changes because it's going to help me with X, Y, and Z. And that's all about the behavioural changes behind it. As I explained, the good thing behind what we do is we can retest, whereas there's hundreds and hundreds of DNA companies out there who are just offering a DNA product. Quite a few do disease diagnostic and quite a few do ancestry. At this current moment in time, we're looking at your health and well-being. So we're not looking at your past, we're looking at your future. How do you move forward in time and be healthier? And the good thing about this is it can be done periodically. So therefore, it means once I do a block of, say, 12 weeks or 6 months, I can then see whether those changes have had an impact on my biological age. Therefore, what I use it overarching is called my health score. So just a few features and benefits of it. So you can see on the left-hand side of the screen, you've got DNA. This is a one-off test. We have over 300 outcomes here, which look at areas such as nutrition, health, physical, vitamin, minerals, and supplements. And then we kind of have an area called health insights. The health insights area is all based off things that we as people want to change, or we call them passion points from the company perspective, where you might have issues with sleep or stress or mental health or gut health, immunity levels, skin health, anti-aging, injury risk, all these areas here. And the idea, like I say, is to make sure that the information we provide back to the end consumer or to the employee or the client or the patient is how do we then help them make the changes? If they have an issue with sleep, how can we overcome that issue? And that's what we're all about. As I've already explained, kind of the DNA transform is our biological age, again, all done through saliva. We cover the simple metrics of biological age, eye, hearing, and memory age, and then we have a genetic inflammation score. And as I covered a minute ago, the good thing about this is it reinforces good behaviors, but it's periodic, so you can do it over and over again, which is really, really key. Some reasons we kind of work with companies is it's very affordable. Everything we do is backed by science, and nowadays people want to know if they're doing something, why is someone suggesting that? How do they suggest that? And basically, we're the new kind of innovative health screening in the market. So actually, when you look at other companies, and I won't name any, but as you look at other companies, their health screening is done yearly, but there is no real interventions put into place. They just tell you the kind of, these are your scores, but not really giving you the help and stuff that you need. And their price point is very, very high, whereas ours is nice and low. It's a company-wide solution, so it's accessible to everyone and anyone. So it's not just kind of for your senior members of your team; it's for every single employee. And the idea here is can we help everyone in the workplace? Good thing is we offer worldwide logistics, so we can send kits wherever you want to in the world. And also we have part of the system we have this portal that we have, and in the background of this portal, we're able to see all the results with your consent as the client, but basically then look from a company perspective. So if the company wants to know more about it and put into place management insights and business information, we can provide loads of data on employee engagement, we can employee tracking. So what are they doing? How much are they doing? And then basically how can we then improve those areas? So there's kind of 4 key metrics that we kind of look at when you're looking at those areas as a company. Things like, your mental health, anything that kind of stops you being in work, really. So your mental health, your MSK risk, your gut health and nutrition, and illness and level, so your immunity level. So we look at those and then we score them against our whole database to say, this is where you sit, and then this is what you can do about it. A couple of more slides just to finish off before we can have some questions. So the process is really simple. Just want to run you through it just in case you decide to do one. We have a registration, so you just download the app. You can do this free of charge anyway on your Apple or Google or your Play Store, sorry. And you can actually click on the word explore at the moment, and you can look at our app for free. So you can go on there, have a look at demo data and see kind of what you're going to get before you buy. So basically try before you buy. You can then do your samples. So your samples are saliva analysis, very, very simply to do. Inside the box that comes to you is instructions and gives you all the information. And we also give you a return envelope which is raw mail track delivery. And then you send that back. And then within 2 to 3 weeks, you'll receive your results. And the final little bit, just so you could see a little bit more information about the company and kind of an example of some of the corporates we've worked with. You can see here on the screen that we work with 148 employees from a certain company. And you can see that over the time when we intervened and we helped them understand their results, and they used their app and they were engaging in the app, you can see here that their actual biological age is reduced, which is obviously what we're trying to do and trying to achieve. And the main reasons are shown below: why acceleration or de-acceleration. Again, these are things that we already know. We know that we need to have the correct sleep patterns. We know we need to eat correctly. We know we need to do some exercise. So these are things we know anyway, but all we're doing is hyper-personalizing that and allowing them people to see it in more detail. Really thank you very much for your time on that. And now I'd please like to open the floor to any questions.